like to welcome all of you to the first annual um, Africa Solutions Community Forum on HIV. And I'd like to thank the Minneapolis Urban League for allowing us to have our forum here today. First, I would like to welcome Stella Whitney West, the Chief Program Officer of the African American Urban League, to give a welcome speech to the guests. Thank you.
Good afternoon. I'm Stella Whitney West, and I'm Chief Program Officer for the Minneapolis Urban League. And I just, first of all, want to thank African Solutions for putting on this community forum. And I'm really grateful for the partnership that we have with African Solutions. I think it's important for our two communities, the African community and the African American community, to work together to see how we can turn the tide on this epidemic. We know that it impacts our community at a far greater rate than the general population, and it's important that we work together to come up with the strategies and the interventions that are going to be effective. I think, too, what's extremely important is that we cannot be complacent. I think that one of the most difficult things is that whereas on the positive side that more and more people are living with HIV, and because of the advances in medicine and drug therapy, there's a tendency for people not to feel that there's still a need for the man who is very involved, and so the tendency, as he has said himself, is for people to have this perception that, oh, well, they must have conquered HIV, it's okay, don't worry about it, and it's not okay. It is still a cause for concern, and we must continue to make sure that the message gets out there that this is a preventable disease. There's no question about it. And we need to do everything that we can to make sure that the prevention message is out there and is strong. So I want to welcome you to the Minneapolis Urban League, and again, thanking African Solutions for this opportunity and for this great partnership. Thank you.
Okay, next we're going to have Lucy Slater from the Minnesota Department of Health to explain to us different statewide policies on HIV and AIDS.
Well, I was asked to speak about statewide policies in HIV, and there's so many statewide policies about HIV, and I was so sort of unclear about which ones you wanted to know about that I sort of changed this presentation to thinking about what is our HIV/AIDS system in this state. I've been having a number of conversations with people in the African community as they start to try and figure out how to access funds or start to implement programs And many of the challenges that I see that people are running into, or small agencies are running into, is they're just not really aware yet of where they fit into the system, who they should know, who they should be talking to, and how to connect with other people. So I hope it's helpful, but what I want to do is just provide an overview of what our system looks like in this state. For some of you, you're probably really, really familiar with this and heard it many times, and so I apologize. And for other of you, it's not something you're interested in at all, so I apologize for that too. But I do encourage you to stop and ask questions or follow a thought that you might have about this, and I'm happy to sort of be dragged off track if that's where you all want to go. And there's nothing else out there in the community to help you. There's not many NGOs or community-based organizations or independent advocacy groups. That might be another way to organize your system. In this country and in this state, we kind of have both, which makes it confusing, but I think it kind of makes for a strong system. We have a mixture of strong government, and we have a lot of services that are provided by independent community-based organizations. And really what how does it work? Huh? All right, I'm good. And so yeah, we have some services that are provided by independent organizations and some that are provided by government. And really, the role of, it's a challenge, but it also is a benefit, is that all of us, as we deliver services, also have to think about how we communicate with other people in the system. So this is just a little model to show you how the funding system works in this state. Most of the funds for HIV and AIDS across the country these days come from the government, either federal government or state government. There are places that you can go as a small agency to get funds from private donors. And particularly in this state, you might find foundations or private donors who'd be willing to support you. But on the whole, the bulk of the funding that's available for HIV and AIDS comes from the government. And there's two levels of government from which the funds come. And at the top line there, you'll see federal funding, the federal government. In the federal government, we have two agencies that provide funds for HIV and AIDS. In many other countries, they don't divide up care and prevention services in this way. In our country, we do, and I think it's probably not such a great idea. But anyway, that's how it works here, and so we have to manage in that system. On the left, you'll see federal funder. It says CDC. That's the Centers for Disease Control and Prevention, and they provide federal funds for HIV prevention services only to states, like state health departments, and also directly to community-based organizations. So you'll see two lines that come down from there. There. One that points to MDH, which is the Minnesota Department of Health. So we get funds directly from the Centers for Disease Control, and then another line that goes right down to the bottom where it says community-based organizations, clinics, and local public health. So the CDC funds both those levels in the community. And then on this side, you'll see another federal funder. It's called HRSA. It's the Health and Resource Services Administration. And they provide all the funds nationally that are available for care services for things like AIDS drugs, insurance, health care, case management, all the services that are needed to manage and provide for somebody who's living with HIV. And they do the same thing. They fund states directly. Well, they do a lot of things, actually. And they also fund community-based organizations and the local level as well. In fact, what you see up there is two titles, Title I and Title II, and then there are about 5 other titles as well, which just complicate matters if we go into too much detail about them. But basically, there's two streams of funding that come from CARE. Title I that goes to the metro area, so Minneapolis and St. Paul, and Hennepin County Community Health Department receives those funds in this state. And then Title II, which are funds for the whole state. And those funds go to the Department of Health and Human Services. So we have two agencies at the federal level that provide funding. And then at the state level, there are 3 government agencies that provide funding or services. Department of Health, which provides prevention services. The Department of Human Services, which provides care services for the whole state, which I think is really, I'm making this up, a dental one. Do you know any more of Red One?
Yeah.
Go ahead, you say Red One.
Title I is for metro area.
Yes.
Title II is statewide. Title III is for clinics and research centers.
Right.
Title IV is for I think other, like you say, the social service
Mhm.
agency, but all of them are not related here.
Yeah. And government agencies are really only eligible for the first 2 titles. And because we have fairly low incidence and prevalence in this state of HIV compared to other states in the country, many of those titles we're not even eligible to apply for. So that's another reason that we don't really know about them so much, or at least I don't. So, a very strong role for the community in the delivery of services in our system. Now I want to just show you how, so that was like the funding structure. Now I want to talk a little bit about planning for services. How we decide in this state what we are going to do in a coordinated way to address the prevention needs of the community and the care needs of the community. One of the problems with having lots of non-governmental organizations and international donors that I've noticed, or that people talk about in other countries, is that there's no coordinated program. Everybody has a different priority depending on what their agency is and what the mission of the agency is. And you'll often find lots of money coming into a region, but no coordination of that. And so there's duplication, and then there's gaps. So what do we do in this state to make sure that those funds that come from the federal government, that come from the state government, are coordinated and we're delivering a coordinated system? Well, we have planning, planning activities. And because of the way our system's set up, where we have care on one side and prevention on the other side, unfortunately, we also have planning that's separated, care planning and prevention planning. But the model is pretty much the same in both areas. So for prevention planning in this state, the Centers for Disease starts up at the top on the top left-hand corner. Centers for Disease Control requires of us at the state level, if the Department of Health wants to get any money from the federal government, from the Centers for Disease Control, we have to follow these guidelines. And they develop some guidelines about how we do planning. They give us money. What's key about this whole process, in some countries you might find planning just happens at that, then it stops. There's no additional piece that you would find just that the government agencies would do the plan and then we would implement it. What's key about the way we do it in this country or in this state is that there is a role for the community in that process. We are required to, the health department is required to pull together a community planning group, which in this state we call a task force. And that group is really convened and set up by the community, that the members are representative of the epidemic, that they do the resources that are available for care, what the priorities are, and where those funds should go. And again, it's community-based organizations on the whole that deliver those services. Now, the reason I'm talking about that is to just really point out that there's a crucial role for the community in figuring out what we do with the federal and state resources that are available for HIV prevention and care in the state. And that as members of agencies or community members who care about HIV in your community, these planning bodies are really important and effective ways for you to be involved in ensuring that your needs get met by the funds that are available in the state. Does that make sense to people? Questions? that was the difficult part. And I'm really sorry, on the handouts, all of those, they didn't print out, we just got blank boxes. Yes.
Do you have a lot of people calling to the state asking about resources in the community?
Do we have
Get a lot
people
of calls.
calling us about resources?
Yes, people that are HIV positive. Do you have calls asking about community resources?
Yeah, we don't get so many telephone.
The question of being involved with a community-based organization that's looking for funding.
No, just any
Just
individual.
Individuals. Not as many as we used
Elizabeth may
to.
have
Yes.
more
Yeah.
now, but you.
We really try to set up a system, at least at the health department, to triage those calls so that they don't come to us, they go directly to the providers who can address those needs. So the publicity that we put out there about who should you call if you have a question about HIV or AIDS is to go to the Minnesota AIDS line. And actually, I'm going to put that number up here in just a second.
Are you talking about someone who is infected with HIV, or are you talking about that?
Just any
Yeah.
citizen.
Yeah, if someone, normally what happens is that if someone is infected or if they went to a doctor and found out that he's HIV positive,
I think more people who are African or who are
Mm.
certain, organizations.
Yeah, we do. We do. People do call
Thank
us.
you.
And then we try to refer them on to those kinds of places. So just to talk a little, it'll become clear to you how, if you're an individual or if you're a community-based organization, how to relate to us. What it is that we can do for you, and what it is that we can't do for you. So, the Minnesota Department of Health, which is where I work, is responsible for STD, sexually transmitted disease, and HIV prevention across the whole state. And we use the funds that we have available for STD and HIV prevention in two ways. We provide some services directly out of the health department, and we provide funding to the community to provide services also. And our philosophy really is that we should each do what we do at best. So what do? We provide partner counseling and referral. Basically, that means if you get diagnosed with an STD or HIV within a public health clinic, like the Red Door or Room 111, or, well, actually any diagnosis of HIV in the whole state, that gets reported to us at the health department because it's by law goes to a disease, to the STD or to HIV. So that's the service that we do directly out of the health department. Other things that we do directly out of the health department, a lot of our media activities are really right out of the health. No, but they tend to be where to send them to help. We have programs in the community to help them. Send them to Hennepin County to get case management services. Once our Red Cross work is done, get training from them. and learn how to provide HIV prevention and awareness education to your peers in the community. And then finally, I said participate in our state planning processes that we talked about earlier, both in prevention and in care. Your voice is needed and valued in that process. And then finally, and this is Rebecca Namara, she's our contact at the health department. She will help you figure out about how to get outreach and education. If you want somebody to come and talk to your group, she'll do it or she'll find somebody to do it for you. She'll let you know when that curriculum's done. She'll let you know when that money that's available in 2004, when it's available and how to apply for it. If you want capacity building and technical assistance for your agency, talk to Dr. Sahai. I hope you don't mind I put you in the phone. If you want help, there's the Minnesota AIDS line. If somebody comes to you and says, how do I do X, Y, and Z, and you don't know the answer, where to send them to help. We have programs in the community to help them. Send them to Hennepin County to get case management services. Once our Red Cross work is done, get training from them. and learn how to provide HIV prevention and awareness education to your peers in the community. And then finally, I said participate in our state planning processes that we talked about earlier, both in prevention and in care. Your voice is needed and valued in that process. And then finally, and this is Ruth Namara, she's our contact at the health department. She will help you figure out about how to get outreach and education. If you want somebody to come and talk to your group, she'll do it, or she'll find somebody to do it for you. She'll let you know when that curriculum's done. She'll let you know when that money that's available in 2004, when it's available and how to apply for it. If you want capacity building and technical assistance for your agency, talk to Dr. Sahai. I hope you don't mind I put you in the box. If you want help, there's the Minnesota AIDS line. If somebody comes to you and says, how do I do X, Y, and Z, you pay these folks to know those answers. So, and then if somebody wants to know where can I get an HIV test, there's a list of HIV testing sites. And that's the end. Any questions or thoughts or? I hope that was okay instead of planning whatever it was you were asking to do.
This is Borhe's girlfriend who comes to visit Borhe to demand for money. Instead of giving her money, Borhe gives her condoms. He tells her she should use them with her other boyfriends. The girl gets quite angry because she wants money, not condoms.
Les livres et les cahiers sont indispensables, mais pour l'alimentation,
C'est un peu vraiment rage. Le sud est en train de tuer les gens partout. Hein? C'est pas comme nous autres là, qui sommes obligés de vivre au temps. Tout ça là, c'est attention.
Tu n'as rien dans ton tiroir.
States that she's never had sex with a man without condoms.
Je vais finir mes études d'abord. Commencer à travailler avant de penser à moi. Ça va. Aussi, je comprends bien. C'est surtout de ne pas avoir d'enfant. Bien que tu vois là, tout tu le connais. Il n'a rien. Donc si je peux grossesse avec lui, il va me demander d'avorter. Comment je vais passer? Quand je finis mes études plus tard, pour voir une enfant avec mon mari, j'aurai les complications. C'est tout cela que je lui ai dit. L'abstinence, le préservatif, c'est tout le
In this case, she's using condoms to avoid pregnancy and also STDs. With the same girl as Mr. I Love You, Borhe tries to assure his son, and then Delta comes home. She sits down on the couch and says she's tired. She gives Borhe condoms.
Donc, les filles ont commencé à pleurer. Bon, non pas pour I Love You, mais pour toi. Parce que I Love You est sorti avec la même fille. J'étais sorti avec elle, comme on dit la vérité. Non, ça c'est une pauvre enfant que j'aide de temps en temps. Sinon, écoutez, votre papa, quand même, il sait où il poser. Excusez-moi, monsieur.
Pour les utiliser.
Eleanor asked about the condoms. How many can I use per day? Delta explained the purpose of the condoms to her and how to use them. Eleanor says, well, anyways, my boyfriend and I are separated. The butler jokes, well, how about having me as a replacement? We're back to Goho's house. Clementine wants to go and buy bread for breakfast, so she asks her husband, Goho, for money. Instead, he looks for his coins in his pocket and pulls out a condom that Bohri gave them earlier by mistake. He tries to hide it, but Clementine sees it and gets very angry. She demands that he hand over the condoms. He refuses and they begin to fight fiercely in anger.
Really, mother-to-child transmission is going on. The reason that it's particularly tragic is that when treatment is available, we can all but prevent almost all of those transmissions from mother to child. When treatment is not provided, the transmission rate is about 25 to 30%. And with treatment, as low, probably lower really than 1%, but 1 to 2%. And so this 720,000 new infections, I'll also compare to what we see in the United States in a second. 58% of the cases in living in sub-Saharan Africa are women. And that's also a little different. And that is roughly, or rather, the occurrence of mother-to-child transmission in sub-Saharan Africa is 800 times more likely to occur than what we see in the United States. And that is by and large a function of access, availability, and the financial resources to provide treatment to pregnant women who are infected with HIV. Additionally, unlike what we see in the African epidemic, 25% of cases in the United States as a whole are female, and a total of about 900,000 people. Now, this 25% of cases are women. That's amongst the whole epidemic in the United States. And in a moment, we'll see when we look more specifically at what's happening in African communities, with here in Minnesota, which also likely applies to the United States. It's a lot more similar to what we see in Africa, with kind of a 50-50 balance. But that's just wanted to give you kind of a national picture. That's available can both extend the life of people living with HIV as well as improve the quality of life. And like I said previously, that treatment can prevent nearly all cases of mother-to-child transmission of HIV. We also have the benefit of 20 plus years of widespread education and prevention messages, and so a population that is in a way used to hearing about HIV/AIDS and discussing it. That's kind of coming back around to hurt us in that people may be getting kind of desensitized to. There are 40,000 new infections that occur in the U.S. each year. Again, 900,000 people living with HIV/AIDS. Because of the availability of treatment, we have really a pretty low mortality. And in 2000, which nationwide there were 14,500 deaths. And that is just a drop in the bucket compared to what we see in, particularly resource-poor areas. It's also a problem in Minnesota, despite Minnesota being a low to moderate incidence state. We still experience just over 300 new diagnoses of HIV each year. And those are actual diagnoses. Of course, we know that people can be infected with HIV for many years and not be aware of their status. So there probably are many more than just the 300 infections actually occurring in the year. And the data that I have, that we collect at the Minnesota Department of Health, don't reflect that. So whenever we're looking at data, it's always a minimum. It's probably more than what we're seeing. In Minnesota, at the end of 2002, there were about 4,600 people living with HIV/AIDS. And similarly to the nation, we also have very low mortality. In all of Minnesota, we just had 46 deaths among people living with AIDS in 2002. And the little graph there on the side is just depicting the increasing number of people living with HIV/AIDS here in Minnesota. And that the increasing number is a function of both low mortality, in fact, a decrease in the number of deaths occurring in Minnesota. Community forums and other activities going on in the African community related to HIV/AIDS is that this really is a growing problem here in Minnesota. You know, we're not looking at the sort of burden right now that's occurring in Africa, but as this graph depicts, over the past several years, we've seen a very linear increase in the number of new diagnoses among persons born in Africa that are living in Minnesota now. Between 2001 and 2002, in fact, that represents a 41% increase in the number of new diagnoses. And then to focus particularly on women, this is a graph just looking at the green line different number of nationalities as well as cultures, even within nations. Similar to what we see for all African-born persons, because we're kind of focusing on women today, I wanted to present what we see among women. So at the end of 2002, there were 166 women living with HIV/AIDS who were born in Africa, and 70% of those came from Ethiopia, Kenya, Liberia, Cameroon, Uganda. And unfortunately, we don't have a way beyond kind of nationalities to identify groups within that. So, for example, for Ethiopia, that represents Ethiopians as well as folks from Oromia and any other locations there. And then there are 17 other countries that make up an additional 30% or nation you're talking about. And some of these are the very same issues that were being dealt with here in the U.S. 20 years ago, and to a certain extent, continue to be dealt with. There are social factors in terms of the empowerment of women. There's the belief that women don't have the right to ask that her partner use protection. Other myths that perhaps one's risk was left behind them in Africa. Questions about the actual contagiousness of HIV, that it is actually just a curse and that one doesn't have any control about the transmission. And horrible stories about stigma, and there is denial, of course, fear, and last certainly but not least, competing priorities of housing, employment, childcare, all these sorts of kind of everyday survival things that easily can move up in the priority list above that we also have each other in this fight. There's not a day goes by that I am not inspired by some of my colleagues at work, and Red One is one who regularly inspires me with his commitment and dedication to this, to bringing the issue and the challenges and the needs of HIV/AIDS among African communities. That inspiration and seeing the commitment with colleagues.
In year 2003, we have 5 million injections worldwide and 3 million deaths, they say. The more we talk about HIV, and the more it seems that the infection is getting out of hand globally. And do you think that we will have that kind of change here for this 2003 here in Minnesota too? Or I'm hoping that we won't, but what do you think?
Right. So Red One's question was, given what we've seen with the UN AIDS data that they released on World AIDS Day for 2003, and it looks scary. 5 million new infections, 3 million deaths. Are we going to see the same thing possibly here in Minnesota in terms of the trends? And we release our data. Theirs is estimated data, or our estimated data, and we release our real data in every April for the previous year. But we do during the year keep track of what's going on. And if things continue, we won't see that. We will, in fact, what we will see for this coming year is, you know, a kind of a flattening of that linear trend that we're seeing in the African community. So the news is not as bad for us as it looks like for the world. If that's encouraging at all.
I also heard that you are expecting, Minnesota is expecting few HIV positive refugees. Is it true?
So is the question, is Minnesota expecting a few more HIV positive refugees through the federal resettlement program? That's what I've heard too, that we are expecting a few more.
Why?
I'm just going to say that wouldn't it be true though if the more we do education in the community, the more people become aware of it and get tested, maybe the HIV positive individual number might increase.
Mm-hmm. That's an excellent point that Elizabeth is making, that that is possible. And so it's hard to know, should we be glad that we're seeing more people because we're identifying more and getting
Not infected, can there be a healthy baby? And even the only way that the baby can be infected is if the mom's infected. It never happens that a baby will be born infected and the mom wasn't infected. That never happens. And we understand that to a great extent because the sperm itself, if you look at sperm itself, it doesn't have the virus in it. It can be attached to all the cells that come with the sperm, but the sperm itself doesn't have the virus on it. So, and it doesn't get integrated into the sperm. So it's, it takes that exposure to happen. So that's one of the questions we talk about is, what about a situation where the future father is infected and the mom's not? What do you do? How do you make that a safe situation if the family wants to have kids? And we'll talk a little bit about that as we go on. So, but just to make the point, even I started doing this work in 1986 in the Bronx in New York. We had similar kinds of rates in the Bronx and in Newark, New Jersey, where I worked, as are existing in sub-Saharan Africa now. And 25% of our young men were infected, and 15–20% of the women were infected. So it was very similar in those years to what's happening in a lot of countries in the world, including sub-Saharan Africa right now. But back then, we didn't know how to prevent babies more often than they used to. And I think it's a logical decision. It makes sense, given what we know about how to prevent transmission, and also what we know about how to help people stay healthy so that they can continue to parent their children, so their children won't end up being orphans. So here, in our practice especially, we don't think that's an outlandish decision. That could be a very reasonable decision for a family to decide to have kids. And but we know in the community that there's not always that point of view. And so we recognize that a lot of our families are living with a lot of pressure from the community that if you're infected, you shouldn't have children. And so part of our goal is to get the word out to the community that, it could be a good decision. And each family is going to make their own choice about whether they want to have children or not if they know they're infected. But there's a lot of reason that they could expect to be around to parent their children, to be alive throughout their children's life.
Is this via in vitro fertilization?
No, just...
Because doesn't that put the woman at risk?
Well, again, let me come to that when we talk about in vitro. We can talk about that in a minute. We don't have access to that kind of reproductive health. The women that are having healthy babies now are doing it just by taking medication and getting good obstetrical care and good HIV.
Dealing with pregnancy. Is there any
Well, the question was, at what stage does treatment start during pregnancy? And ideally, you want to start therapy even before you get pregnant, because if you could have your whole pregnancy happen with you being in really good shape, really good health with your HIV, then you can decrease the risk even lower, because some of the transmission could happen really early in pregnancy. But the recommendations are to start therapy at least at the end of the first trimester, the first 3 months. So, you know, whenever people find out they're infected, that's when they need to be having conversations with their doctors to find out how to do this the healthiest possible way. And Peggy was going to talk a little bit more about that. This is just a graph showing the births to HIV, which looks at the different, breaking down by different race and ethnicity. And I think you can see the orange bars are the African-born. No, I'm sorry, the orange bars are African-American. The pink is the African-born, with a significant increase over the years. And it gives the virus kind of complicated. And I do think as studies work to make sure women are on therapy not only during pregnancy but after pregnancy, we might be able to answer the questions, but we don't know yet.
The couples who had these children are both positive, and they haven't taken any medication. It's how
Well, statistically, it's possible. Like, you know, even when I worked in Newark, where, you know, in the late 80s, early 90s, where we didn't know how to do any of this, a lot of the moms weren't on any medication, and still less than half the babies were infected. But it's still, you're playing a game. You know, you're playing what we call Russian roulette. I don't know if that's a universal expression, but, you know, you don't know if the gun's loaded. Another one later who wasn't. It isn't that you can't tell who's going to transmit. Although the better your HIV is, the better your chances are. You know, the more controlled it is, the less active the infection is, the less your risk of passing it through the baby. You know, this is, for me, as a physician, as a doctor, and also as a mother, this is one of the most exciting things for me ever. I mean, if somebody would have told me in 1990 that 10 years from now we'd be talking about mothers having a less than 2% risk of transmitting the virus to their baby, I wouldn't have believed it, you know. And my experience then, I was going to funerals every single week, you know, of kids that I had known and that were dying, and parents that were dying. Every single week that was happening. And now it's not even on our radar screen. That's not even what it's about anymore. What it's about now is it's a lot of work to take medication all the time. You know, it's the stigma, and not only in the African-born community, I mean, even in Minnesota-born, it's still stigma's a problem. But I think in the African-born community in Minnesota, it's much worse. So those are what the issues are. It's not about dying anymore. And so I think the opportunity to not pass it on to your children is so amazing and so fabulous that, you know, we don't have anything else like that in HIV. There's no other intervention that we've done that's been so powerful as what we learned how to do in terms of preventing it.
What about the side effect of the babies?
Yeah, there's, it's been something that's been looked for all along. This original study that talked about how to use AZT, within the study looked at side effects in the baby and in the mom. And then since then, those kids all in the system, and they passed.
Kissing, like tongue kissing. Can it be spread through the saliva?
No, HIV cannot be spread through kissing.
Okay.
Because you have to come into contact with body.
And you know, the only way that can happen, you really have to have an open cut or something where the blood is going to get you, and that way you can get it. But no, not through kissing.
Not through saliva. Because when we looked at the 4 body fluids, Saliva is not one of them.
This is saliva, body fluid?
Yes, but that's not one of the body fluids where you can get AIDS from. The only
The
four
virus
body
cannot survive with the saliva. It's, yeah.
That's also a question. In the civilized country, when they eat the food, they eat separately, at their own. But as you know, in Africa, we eat together. Like you share the food. Suppose one of my finger is cut down and bleeding. You just put a small piece of cut, then eat together. The blood is fresh, you see. Those people who are around, I don't know how this. What do you do about it?
Well, that's a good question. I think, those are very rare cases. You can still eat together, but I don't think somebody's just gonna have enough blood in the food to infect everybody. That's what I'll say.
We don't know. You know that
Now,
this is not a. We are eating together. I am Ethiopian. We have one table. In one table we eat together. I don't know whether I have this HIV. I didn't go. Nobody tests that have this HIV. I eat together.
No.
Yeah, I understand your point.
Yeah,
but what I want to try to say is that even the virus, the HIV virus itself, is going away very quick outside.
It dies.
It's not a big
Yeah.
deal.
No, the virus
If you
does
have
not
somebody
survive.
having someone cutting it together, this can be. It's not like it is. The only way to get HIV, there are 3 ways to show. Mother to baby, heterosexual, sometimes without protection, and blood. Otherwise, HIV has that.
So if there's a chef that has HIV and they accidentally slice their finger and it gets into the food, can you get it that way?
No.
No, because once it touches the air,
It dies.
Okay.
And also cooks have to wear gloves. Scrubbing their hands with food.
Anybody satisfied about that? Chaffet, can you add anything about that question?
What I would say actually is that in the real world, nobody can eat while you have a bleeding finger. Actually, it will never happen. And the amount of blood that somebody has to take to get infected must be a massive amount of blood. Actually, and it has to have that your skin also has got also a cut. There has to be, there's an opening in your skin so that the other blood can get into it. Therefore, it's really
Because it's more
very
of a-
hard to
It's
be-
more, it grows in the blood, right?
Right.
And that's why you can't get it through saliva because it doesn't have
Exactly, because
the
we
blood
have some protection
enzymes.
in our oral system. So even if you swallow the blood, there is some protection. When you eat food, there is some protection that separates what's poison, what is good, and what's bad. So it doesn't get absorbed to your blood system. So that also helps. Now, can we keep on going? Okay, so now we know what HIV is, how it's spread, how it's not spread. How can we stop the spread of HIV? People can choose ways to be affectionate that do not spread HIV to others. That's the big thing. Being affectionate to our lovers, to our husbands, our wives, boyfriends and girlfriends, that's the big deal. Can we be affectionate to each other? That's the hard part of it. So that's one way. If we can be affectionate or trustworthy to each other, then we can stop the spread of it. Tell your partner the truth. If you go out, engage in other activities that are outside your relationship, please don't bring it to the other person. Just make sure you know you are protected before you engage in your sexual property. People that you don't know.
Condom, I heard you use that too.
But what we know is, what we know is, please use condoms. They are here, they are free.
They have female condoms.
Just get them. They are female condoms and they are male condoms. So it's not like you don't have it. They are here, they are free. So please use them if you need them. And let us forget about the other things, plastic bags and all those things. Let us know that we have to use condoms. So, stop by Chelsea if you need condoms. Anytime his office is upstairs. Which room is that? 304 West.
And he leaves some with me. I have them in the office, so if anybody needs any time, they could just come and ask.
Yeah, and don't be ashamed asking for them, please. It's good to get them and protect yourself and others other than, shying off from getting them.
I have a question. What kind of condoms do you got here? Like, if you got Magnums, Rough Riders?
No, we don't have, they don't have any, they just have the lifestyle, the proper kind. I mean, are you an experienced user? He just had the regular ones, I don't know. I don't know what you're talking about.
Let's keep on going,
Rough Riders.
You're running out of time.
When they go with women, they do it real rough.
Okay. I know we said about injecting or using needles.
Can break,
And you people inject non-prescribed drugs like heroin, cocaine, and they can prevent HIV by using new start equipment. You need a needle. And I'm not saying this, that there is somebody who's taking drugs, or I'm not here to stop you not take whatever you want to take. But if you are doing it, please use a new start equipment.
Don't they have a drug, a needle exchange program here?
Yes, they do.
Where they go around and exchange, if you drug user, you could go and get a clean needle where you don't have to use other dirty needles.
Exactly. That's a good point. And never use or never share needles. The most effective way to prevent this is through use it into treatment or stop injecting drugs. So be careful if you have to use it. Get the exchange program, get a new needle, but don't sell it. You don't know what you are selling.
Isn't that where a lot of major, a lot of people are getting AIDS now from, is the sharing the needles?
Yes. A lot of people are getting HIV by sharing the needles.
And young black minorities is a fast growing rate of AIDS.
One that asked a question about. The risk of getting HIV from blood transfusion is very extremely low. When you go to the hospital, you are getting blood. The blood has to be screened, thoroughly screened before the blood is put into the system. So the chances of you getting HIV from somebody's blood is very, very low.
Now, are you able to move?
Those cases are now getting very, very rare.
At first, a long time ago, I know they wasn't testing blood. And I know that they was you can get HIV from that because they weren't testing blood back in the day.
But now they are.
Now they have to be extremely careful because they don't want to infect anybody from giving them blood.
Oh, okay.
And it was the hemophiliacs
who died in numbers. In France, 300 of them died because the product to treat their illness was made from the blood supply, and that hadn't been thoroughly tested. There have been scandals. The Minister of Health in France lost his job over this. And there's been a lot of stories in the paper and written articles about it, so they were forced to test all the blood. I think by now they're not people that were victims of this before, because it's about a 10-year period. But before, like in the beginning of the 1990s, it's possible there were people who had gotten infected through blood in the blood supply.
Yes, that's true, but now things have really changed. People are aware. The doctors, the medical team is very, very aware, so they cannot do anything. But it's gonna mess up somebody in their life. All blood donors are screened. If you go to give blood, they will take your blood. Of course, they will not deny taking your blood, but that blood has to be screened before it's transferred to somebody else. All blood that tests positive for HIV is destroyed. If you go, you want to give somebody blood and they find that your blood is HIV positive, they'll just throw away and destroy it. So they won't have to do anything with it other than throwing it away. Okay, stopping the spread of HIV. One good thing, we can choose not to have sex. Especially for young people, you can choose not to have sex when grown up. If you think you are not in a married relationship that is very affectionate, you can postpone not to have sex until you are married. And for young people, if you decide to marry somebody, it's good at least go to the doctor, get tested before you marry that person. That's how it is right now. Because you cannot tell just by meeting somebody and say, oh, I like this person, you know. You don't know what you are ending up with. So you can postpone not to have sex until you are together and you know you are committed to each other. And finally,
job, the struggle, poverty. What we do in public health issues is to try to explain, inform the public how to protect themselves from disease, to make right choice for themselves and for others.
Yeah, it all comes down to education.
Yeah, but you're right. We should also talk about poverty. But let me also tell you something. Money is never enough. Even we have job for everybody in Africa, it's never enough money.
Education.
Education is more awareness. Take care of yourself, of your health. It's not because you need money, you can put yourself in a dangerous situation. Use latex condom every time you want to have sex with somebody you don't know, or you may know but you are not sure. This is the message we try to bring out. Otherwise, you're right. If we could have the means to fight, the hunger, the poverty everywhere in Africa, that would be the best way. Unfortunately, we must be realistic. We have to work as the public health professional way, to bring the message of a healthier message to our population.
Okay, and my last comment now is, I'm glad you have gotten this information. I hope you will use it. You'll use it for your own good, for the good of your family, your friends. Don't shy out from telling somebody about it. Because if we don't, then we will not have healthy message now. So just be a letter to others, tell them what you know, and in that way we can protect ourselves and everybody else. Thank you.
And also one more thing before we wrap up. Africa Solutions project is doing this project in collaboration with some other organizations like Africa American Health Task Force, Minneapolis Urban League, and we have funded from the Department of Health, Minister Department of Health. So anybody who is interested to be involved in this project, in this program, is welcome. We are on 3rd floor, room 304 West. We have outreach program, we have workshop program, we have community forum program. So anyone who is interested to join us is free to do so.
And they brought some snacks over here, some chips and cookies and something to drink, so you're welcome to them.
1 minute. I just want to take 1 minute to talk. We offer free HIV testing. It's not with blood at all. It's a little tool that you place between your gum and cheek. No blood at all. And it's going to take about 3 to 4 minutes, and that'll be it. And you'll get your results back by next week. So anybody that wants to take time today to have an HIV test, we can maybe schedule a room somewhere downstairs here. It takes 3 to 4 minutes, and that'll be it. And I'll have your results back here by next week. Okay? So again, I'll be in the back of the room if you have any questions. Okay? Thank you.
And once again, thank you very much for your patience, and we hope you listen. We really appreciate your patience. Thank you very much.
Oh, okay.
You want to say something? Okay. So this is...
Thank you very much. Let's give them a big hand. And it's some condoms up here, so if you'd like to have some, I'll place them right here on the table.
After 6 o'clock, after 1800. Tonight, I'll come and take it. Not now,
Oh, well, you better take them now and save them for the night.
I don't need it now.
Take them now and save them for the night. Thank you. Take them. I see the ladies are not ashamed.
Yes, they are.
The guys don't want to take them, but the ladies not ashamed. The ladies, go ahead. Boys on the youth.
So fast. People infected with HIV may look fit and they will always look good. You meet somebody, you cannot tell this person is sick. That's the problem. People think people who have HIV or AIDS must be so skinny, or they must have something on the skin that you see right away, but that's not the right thing. okay, well, somebody can look very down, but still can give other people AIDS. Can infect others even if they don't feel sick. You don't have to feel sick to give somebody AIDS or HIV. And may have the symptoms may feel like any other disease. If you feel, if somebody has HIV or AIDS, they are not going to tell right away, oh, I think this is HIV. They might feel like they have a flu, they have other symptoms that are very related to other diseases. And when people develop AIDS, they may get ill that healthy people usually do not get. If you are infected, you might feel or fall sick. Your immune system is very weak. Even the cold can just come and put you down because your immune system is weak. And only a test can show if someone is infected. We cannot tell just by looking. The only way we can know someone is infected is by being tested by a doctor. And then you are told whether you have HIV or you don't have HIV.
Excuse me. Yep. Would you simply stop anytime to ask a question?
Sure.
Okay, the first paper has said that your kush is through blood transfusion. How will you know if the person, if they get somebody of blood? Because you do get AIDS through blood transfusion, don't you?
Yeah.
But the paper doesn't say you don't. Is it true? At the first maybe I didn't read the last paragraph. On the first paper.
No, at this time, you can't get
People
AIDS
cannot get HIV when
from
they give blood.
blood
So
transmission.
you test the blood. If you test the blood.
If you are giving blood away, you cannot get HIV.
But if the blood is not tested from an AIDS person, can you get blood? Can you get AIDS through blood transfusion if your blood is not been tested before giving it to a person?
No, you don't get blood if that blood is not tested.
Isn't that how the tennis player got the HIV? Slice AIDS? Isn't that how he got his? What's his name? That great tennis player they had? Didn't he get his through blood transfusion?
Who?
The tennis player, what's his name? Ash? He was a black tennis player, Arthur Ashe.
Oh.
Isn't that how he got his AIDS from through blood?
You know, at the beginning, here by 80 or 70, something like that, there was some cases, a few, but today, since
Then they should make it specific and say today, over there doesn't say today.
today there is no way you can get HIV through the blood where you give it to us. No way. No.
But I have a question.
Yes.
But what about if you don't get tested? What's gonna happen to you? You go worse?
You mean you are infected?
To get tested, it's just to make sure if you have it or not. But if you know you have it, but you don't want to get tested, what about that?
If you are not tested, you mean?
How are you gonna know you have it?
If you want to know your studies, there are many places around here. It's free. You can go to get HIV-free testing. Yes, and it's confidential, and it's free today. We have some information here you can pick up and have more information. Yeah.
Is that enough?
Yeah.
Okay. Okay, our HIV is not spread. See here we...
Is it true that they have more HIV slice AIDS in African and black people community more than the Caucasian?
Where? Here in the U.S.?
Here in the Minnesota.
In Minnesota?
I think I read a paper, it said 1,500 plus African American slice. African people have more AIDS than Caucasian.
Yes, unfortunately, yes.
That's a fact.
So what can African American people slice African people do to prevent AIDS?
That's what we are doing.
That's what we are doing.
Teaching
As we are here today, we are working on prevention. The reason why you are here today is to be informed. To know what you can do and what you cannot do. Make sure you know the facts. You know how it spreads. That's why we have to talk about prevention. And education is the key to this. people are informed, they know what to do, then we'll stop the spread and we'll have less infection going around.
Do you know anybody that had the disease?
Not specifically.
Yes, we.
Yes or no?
We might know, but you know that's very
Well,
good.
you tell me the first way you said if you're going to teach us something, you should know if somebody had it, right?
You know, we see.
I've had cases, I've dealt with people who have died before AIDS. I've helped them, I've lived with some, so it's not anything hard.
No, it's not, because it's just that AIDS is not something you get crushed by talking to someone or shaking in.
Exactly.
Because AIDS is the immune system through your body. It cuts down your immune system, it gets lower and weaker. But it's just that some people don't know that. So you guys really might educate us.
Oh, we know all the time. Sometimes there is information from the state, but they don't give us the specific names. But me personally, I've dealt with people who are infected, so it's not unusual. And here are the ways that we cannot get AIDS. Sharing a toilet, sharing a phone, sharing food, eating food from the same plate with somebody who is infected. We cannot get HIV from things like this.
But I have a question. Like you said, you can't get HIV from like sharing a plate with someone else's food. What if someone else has HIV or AIDS, and one of their fingers were bleeding and probably dropped it into the food and you just accidentally grabbed it?
That's what she said.
You don't get it from it?
Okay, for one thing, when the blood comes out of your body, the virus dies very fast.
Really?
It doesn't live once it comes out of your blood system.
So you cannot get it from it?
No. And actually, it's very small amount that might be there, but you cannot get it that way. Once it gets out of the blood, the virus cannot live outside the body. Yeah. So stopping the spread of HIV, that's what we are talking about, and that was your question. If people have sex using latex condoms the right way every time, greatly reduces HIV infection. That's the big thing. And I believe some of you have got a lot of questions about this point. So if you have a question about this, how we stop the spread, we have to use latex condoms. We have to make sure we are protected before we have sex with anybody.
It's not 100% safe.
It's been proven by the FDA that latex condoms are very good.
Yeah, it must be, a latex condom. Latex, yeah, it must be latex condom.
Is it 100% safe?
The 100% safe is abstinence. The 100% prevention is abstinence. But as human being, that means we can say, because everything can happen, even you just buy a car, a brand new car, just you go outside, the minute after the car broke.
So, I'm just asking a question because you guys teaching us something, so it's a question that I'm asking. So you're telling us that we can use condom and protect them, but is it 100% safe?
Yeah, for now.
No sex is safe. It's 99.9.
Yeah.
It's not safe.
No, safe. Safe. Latex.
But what about it?
Yes.
And there are reasons why some things might occur even if you use a condom. For example, if you use a condom that is expired, you are more likely to be at risk. So every time you go to buy a condom, it's latex. And
make sure you check always the condom. Yeah, those are for you guys. We bring those condoms.
And the person who uses it also matters. Some people might not do it right. So
unless like you use condom to become protected from HIV.
Pardon me?
Unless like you use condom to become protected from the HIV.
It's not just HIV, like any sort
Yeah,
of
and
any
also
lot of
other disease, STD, like chlamydia, gonorrhea, all those protect.
But what about if it broke or something?
That's why you must make sure you have the right condom, the quality condom. That's why
So
we
not
say-
all of them broke?
No. Those are very, very, very required from the federal and from the state. Those real requirement.
That question definitely has to be for the guys.
Yeah, go ahead. Okay, just keep on moving. Stopping the spread of HIV, we are still talking about prevention to inject yourself. So the most effective way to prevent HIV through injection drug is to get into treatment to stop injecting drugs. Don't do drugs. It's not a good thing. Because when you do drugs, you are more likely not to know what you are doing. You are more likely to have a poor judgment and do what otherwise you would have not done if you were in your normal senses. I'll put it that way. And when more effective prevention is not possible, clean, there are programs where for those people who use drugs, they go and exchange new needles with the old ones. So there is no need of sharing a needle with someone. It's not a way of telling people to take drugs, but because of the safety, if they are using them, let them have news radios to check themselves. So that way they are stopping the spread. They will keep on doing what they are doing, but then they are prevented from getting HIV, and they must be disposed safely so that it doesn't injure anybody else.
I have a question. If you like share the needles, you would get HIV.
Definitely.
So
what about if you don't share?
this is what they do. When people use drugs, they use syringes to inject the drugs to the body. So if I use it and I give it to you, because I don't have one, I can borrow one from you right away. So the blood can get it from the other person to the other person's blood system. It's just a way of taking a shortcut to solve your problem. We are still talking about the spread. People can choose to be affectionate to their partners. If you are married, stick to your partner. Don't move around and go home with somebody. Go to your partner. You can choose to be affectionate. If you decide to get married, stick with one person, and you know that is the safest way of doing it. We're going to move too fast because we don't have enough time. Still the topic of HIV, we said abstinence. People can choose not to abstain. And that's what most people are doing today because there is a big scare. If you know you are not protecting yourself, you better keep away from it until maybe you are married and you know your partner is going to be trustworthy. So it's one of the best things that you can be sure you are safe.
Yes, wait. It's the disease. Yeah, HIV is the infection caused the disease.
If a person has a full-blown AIDS, they have intercourse with somebody who do not have AIDS, they don't give you the disease for carrier will give the person the disease. That's what I read. I don't know what it is.
Well, that one we cannot really prove it.
No, but I read it, but I just questioned it.
So what you are saying is somebody who has
full-blown
AIDS can have sex with somebody
and not give them the disease. Or if you took carrier, you get faster, give a clean person the disease.
Yes, that's 100%.
That's what I read.
I don't know if anybody will conduct you now, but I know.
No, but I read that one.
Okay. Good question.
Can we listen to it because we gotta go back to class?
What did you say?
No, I said like wait till you read quick though because we want to go back to class.
Yeah,
She's trying to say like, you know, let you just explain.
we have 12 minutes.
Yeah, we have a few
No,
minutes.
no, it's the question.
And we're talking about alcohol, drugs, and HIV. How is HIV related to alcohol and drugs? Because when people take alcohol and drugs, they are more likely to make poor judgments of what they are doing. So if somebody's drunk, they go out there, they will find somebody they can have sex without being conscious.
protection.
So that's the dressing. Same thing with drugs. We also talked about blood supply. The risk of getting HIV from blood transfusion in the U.S. is extremely low. That's what they say. So every blood transfusion that is made in the hospital, the next one, the blood is well screened before it's transferred to the other person. So the chances are very minimum. Maybe the risks are extremely low. Blood donors are screened for their risk HIV. If you go to give blood, maybe to your family member or you are donating blood, they make sure they screen your blood. If they find out it's infected, they throw the blood away and destroy it. And maybe that's just talk about. Anybody has a question about blood supply? Testing. People who think they are at risk of HIV are in the country go for testing. And we encourage everybody to go out and get tested. It's for other people's safety, for your own safety. So, do not donate blood to get tested for HIV. Don't wait until you go to donate your blood. Find out if you are infected. It's good go continually and get tested instead of you finding out that you are donating blood and you are infected. So, because we don't have time, I'll give this time for anybody who has questions.
Yeah, okay, what we want to say also is that HIV is a behavioral problem. You know, whatever you do puts you at risk or not. So it's not because I'm black, because I'm tall, because I'm short, because my skin is dark. You know, wherever war I come from, doesn't matter. HIV, anybody can get HIV. Since you put yourself at risk. So the most important thing to know is to keep in mind how to avoid getting HIV. Like a sexual partner, you don't know, or you know, but you are not sure. It's not your regular partner. So use all the time condoms and change the condom all the time. And don't use what I said last time in last July in Atlanta. Don't use plastic bag. Plastic, yes, it's true. Plastic bag is not plastic bag is not condom. Use the latex condom all the time, every time you change it. Don't use the same condom. Okay. And we are here to give you more information, so get informed, get educated, and don't stay in ignorance. Always ask questions and find out what to do, how to prevent in your community, how to be involved. And at Africa Solutions, we are open to anybody coming from Africa or Africa. Anybody who wants to join us, welcome. We have the brochure here, we have the phone number, the address, and what we do, we provide outreach in communities. We provide also a HIV community forum, and we provide the workshop in different places like this one, you know, to get people informed about this matter. Okay. So feel free to come to us or to call us or to go somewhere else. You might have information. And share also the information to others.
So what do we do to be part of this program?
It's up to you. If you want to be part of the program, just call us and you get an appointment and we talk and we see how you can be involved. Yeah, very easy. We need people. People to help. Yeah, we have outreach. For the outreach we pay. It's not free. When we go to do outreach service for us, for Africa Solution, we pay.
You guys pay?
Yeah. Where we send you at Red Cross for training, we pay your training and you are certified like head and you do presentation also. And you can be involved like that. There are many ways to be involved.
So do they pay for you though? like later on when you get into the program and you learn?
Like if you're taking the
they get
class.
trained?
Yeah, the class takes about 3 days.
Classes are 3 days. You take classes.
At the medical. The class, if you want to be part of the program, you have to go to the
Then we finish the
get
class
the
and then you
training.
can join
Takes
the
about
program.
3 days.
Yeah, join this program anytime.
So
Pardon me?
No, you pay. But
No, we pay for you. If you come on behalf of Africa Solution pay for you at Red Cross.
Okay, so you
Otherwise,
take so you take the classes and you get trained and then you get into the program.
Yeah.
No, if you want to, if you present it to other
If you want to do presentation like she's doing, but if you want to be involved in the program, you don't need necessarily to take the class.
the outreach, you reach other people.
Other people.
You can simply
You
do
don't need
outreach.
So
And you
like,
can assist to we have a women group. You can attend the women group monthly or every 2 months. Yeah. You don't need to take the class necessarily.
You don't have to take the class?
It depends. If you
are
want,
doing the outreach out here, you can go talk to other people in the community. You don't need the training. But if you have to teach people,
if you know the knowledge,
then you need the training. Yeah.
So do you get paid for doing that?
Yes.
I think that's good.
so feel free to contact.
Pick the flyers,
Yes.
and we thank you so much for
Yes.
taking this time.
Yeah, you too. Thank you for coming.
Yeah. Thank you so much for your time. Yes, wait.
Yes,
I heard you guys say that you just want to keep this about the pictures that you're taking, you want to keep like for later. Because maybe I hope you keep like to your point because like you don't like to sell pictures like in magazine, newspapers, something like that. Because you know how you saying that it's just a record that you want to keep.
No, we just keep it's not for public. It's internal.
Well, that's what I'm saying. Well, usually people always say something like that.
No. You can see yourself somewhere.
No, this is for me.
I hope so.
And we have for women. For women.
What is that?
It's a condom women, female.
Yes, I don't even know. Because I've been married woman, I don't know.
You don't have to be married to know each other.
We have to make
Yeah, take photos and call.
See, I don't even know.
It's for women.
But sometimes you